So in our practice, we see a number of patients who have sports hernias, and everybody is, what's a sports hernia? Well, often, especially men, patients are born with hernias. That's why you find that there are patients in the hospital right after they're born that have hernia surgery. And that's because part of the muscle that should close after you're born stays partially open. And as we get older and we start doing heavy lifting and stupid things like lifting a refrigerator, helping friends move, that hole starts to grow and get bigger. Now, frequently, especially in athletes who are straining themselves, doing a lot of heavy weightlifting to get in shape and bulk up for football, basketball, soccer, baseball, those holes will continue to get bigger and form hernias. Now, a hernia is when tissue from inside the abdomen protrudes through that hole. Often it can be associated with discomfort and pain, especially if you're an athlete. Now, the hernia itself may not be the issue. Sometimes, especially in athletics, soccer and baseball sliding, you can get a muscle tear, which may accentuate the symptoms of a hernia and actually show that you have two problems. One is the hernia, which we call a sports hernia. The other could be a tear of the insertion of the muscle near the groin or the bone near the groin there. In most cases, the muscle tear will get better on its own with rest. However, this athlete may still have symptoms of pain and discomfort, and after they've rested and think they're all better, go back to their activities such as baseball or soccer, and all of a sudden within a game or two, they're feeling bad again, having pain, discomfort, and just can't compete at the level they want to compete. So in those cases, those patients will get referred to us for repair of a sports hernia. To repair that sports hernia, usually this can be done laparoscopically, and it's a case in which you come in, you have it done, you go home the same day, and most of our athletes can be back to their normal activities, back competing within 8 weeks, sometimes 6 weeks depending on the sport. Patients will come in, have the laparoscopic repair of their sports hernia, and within 2 weeks be able to start jogging and doing light activity. At 4 weeks start competing at a higher level in practice, and usually by 6 to 8 weeks get back to their normal activities, playing in games at full speed, full strength. So if you're an athlete or do a lot of strenuous activity or competition and you've got a hernia, the first thought you probably have is, gosh, how long am I going to be out for this, and when can I get back to my normal routine as quickly as possible? While a hernia is not an emergency, it's something that should be taken care of at your earliest convenience. The key is having your surgery at a time when you can take your time to recover and not be forced to get back to your normal activities right away. After hernia surgery, we like you to take a week to just recover and relax. Now, with some people, that's not possible. Some people own their own business, and it's imperative that they get back to their work as quickly as possible. And we do have patients who get back to work managing and overseeing things in 3 days. We don't recommend that, but if it's what you got to do, it's what you got to do. For athletes, the biggest thing is, gosh, how long am I going to be down? How many games am I going to miss with my team and not be there for them? Well, what we ask is that, again, you do your surgery at a time that's convenient for you. If you can play and you're having discomfort, but it doesn't impact your ability to play, there's no real risk playing and doing it after the season's over. However, if you're not able to play and being in a game doesn't help your team at all and actually can hurt the team's effort, it's best to just go ahead and get it done and recover as quick as possible and get back to your team so that you can help them. When you have hernia surgery, you're out for 2 weeks. That means no heavy lifting, no strenuous activity, no pushing, no pulling. It doesn't mean, though, that you can't walk, you can't get on a treadmill, you can't do an exercise bike. You can. We can do those things to help you maintain some shape or sense of activity, and then at 2 weeks, we like to get you back into light conditioning, which means going to practice, doing a light workout, and gradually allowing your body to adjust to the surgery you just have. After surgery, you're going to have scar tissue. That's normal. And after that surgery, as you start increasing your activities, that scar tissue is going to tear. And it may cause some discomfort that reminds you of the discomfort you had with your hernia. That's not something to worry about. That's a normal thing, and we expect that. Once you have your hernia surgery and you've recovered the first 2 weeks, most of the healing is underway, and the chances of you doing something that can disrupt that hernia repair is very low, but it still exists, so we don't want you to take any chances. So for the weeks 2 through 4, we want you to gradually increase your activities, and then from 4 to 6 weeks, start increasing, trying to get to full speed so that by 6 weeks you're back, you're ready to start helping your team out and actually participate in games.